I'm here with Susie, and Susie is a longtime patient of mine. She experienced chronic neck pain for about 20 or 30 years, and I was managing her for some years, I don't know, maybe about 10 years. At least 5 of those years have been with manual therapies, including physiotherapy and spinal adjustments, which sometimes could be up to 3 times a week if that's what was required. When she would have a flare up, she would get so bad to where I couldn't even leave the island. But I talked to her about 5 years or 6 years ago, actually, about regenerative injection therapies, and I think we first did a Prolo treatment about 6 years ago, and then we followed up about a year after that in 2011 with a PRP treatment for her neck. And I was just wondering if you could share your experience with the PRP.
Yeah. The Prolo helped. 6 years ago, I started with the Prolo, and I noticed after maybe 2 weeks a difference in strength in my neck and being able to do more. And, as months went by, it got better. But I still wanted to try the PRP. I finally did, and it's been really amazingly helpful. I mean, just being able to look up and not have to use my hand to pull my head back up, and just not having the constant adjustments. I mean, I think I come a handful of times a year versus a handful of times a month.
Yeah.
I can go 5 months without an adjustment. And it doesn't mean I don't have some pain sometimes or some uncomfortableness, but it remedies itself, which it never was capable of doing before.
Yeah. And for a few of those years at the beginning, you really didn't need any treatment.
I think I came twice one year.
Yeah.
Yeah. And I was coming twice a week.
Yeah.
Yeah.
So that's huge.
So it's
and
huge. Even though it was, a larger amount of money up front at the time, I saved so much money over that year and pain.
Yeah.
Being able to just be functional.
And so pretty much one treatment of PRP in the last 5 years. And for the last year, I'd say I started noticing you starting to have a little bit more either reoccurrences or a bit of a flare-up. They never really turned into anything of the magnitude of flare-up or pain that you would have in the past. But that's when I started to say, well, maybe it's time that you have another PRP treatment. And for whatever reasons, you haven't had that. And yet, even though you've not had that, you've still been able to conduct yourself or do certain kind of tasks and activities that you've never been able to do.
I've only had one incident that I was needing to come a lot, like 2-3 times a week for, it might have gone on and off for a couple months. And then it went back in and seemed like all good again. And honestly, until today, and today's was minor, like it like I said, it fixes itself.
Yeah.
It takes some time. It's not like overnight, and it's not that I don't ever have pain or problems, but it significantly less than all those years prior.
Yeah. Well, that's great.
It is.
Thank
you. And I will get another treatment. I just haven't physically been capable of doing it, but I will.
Thank you.
Thank you.